Alright guys. My presentation is called Be Funny or Die Trying Therapy. So, it's a paid presentation by the Center for People Who Can't Joke. Good. Alright, basically, it's therapy using Funny or Die, which is this caption. Can't see it with all this caption. So, it's a caption game, like $20. Sometimes they have it on sale. Alright, so, that's just the therapy developer percentage. Alright. Alright, here's my patient. He is real somewhere in this world. He is 69 years old. He's male. He's Argentinian. His status is 18 months post-onset of Right CVA with left neglect but no left hemiparesis. He is divorced 3 times. Current wife is mail order bride from Eastern Europe. 5 legitimate children and unknown number of children out of wedlock. His interest is the patient enjoys social dancing, especially the Argentine tango, board games, and anything to do with comedy, like movies and jokes. Alright, his current levels are, he still presents with mild deficits in cognition and language and very mild left neglect. He is both verbose and tangential, and he monopolizes every conversation. He speaks with a flat affect and is somewhat labile. He has great difficulty with understanding emotions and humor, but he wishes he could be funny again. So I made something. Alright, so the activity that I have, it's, comedy is a very complex subject, but for our intensive purposes, it can be divided into 3 stages. The first stage would be understanding any situation and seeing its comedic potential. And then stage 2 would be thinking of a funny comment, action that will make people laugh. And stage 3 would be executing that comment or action just the right moment, to maximize the comedic impact. Unfortunately, at best, we can only help him with the first 2 stages. We can't help him with the timing. And this task of getting back his sense of humor is easier with a game that's already designed to be funny, right? Okay. It's got a lot of hilarious pictures that I've sorted out. I'll show you how I sorted them out. Have you guys heard of this game? No. What it is basically you get like cards, like picture cards and caption cards, and you match them together. Like over here, like somebody matched with somebody crying, like a little baby crying, and the word card, I hate Mondays, right? And then 2 bald guys like fixing their hair. It's best spring break ever. So you try to come up with the best combination, like the funniest combination, and everybody votes on it. They give you like a funny card, like a funny token or a die token. Whoever has the most funny tokens wins, and you get there's like money involved, play money. But that's way too complicated for our patient right now. So I've developed it differently. All right. So the following activity, he can enjoy this with his friends and family, just because he likes board games, and this is a simple activity you can do at home. And you could even ask the friends or family to come over to therapy and do this with him to make him feel more comfortable, And then hopefully it'll carry over. They'll do the same activity outside of the therapy. All right, and it's our hope that he's even just trying to be funny again, that he'll start enjoying his life and his important people in his life enjoy him also, kind of thing. And hopefully, with having said that, his quality of life would hopefully improve as well in a positive way. And because laughter is not only the best medicine, it's also infectious. So, all right. Step 1: remove all inappropriate cards. You can't see it, but this is somebody flashing somebody. This is 2 guys holding each other's back. This is a guy holding a bra. And this is somebody eating a hot dog, provocatively. So as you can see, that's just the pictures. The words, you have to censor the words out too, just for therapy. You're not trying to start them off with dirty jokes. So, all right, level 1. for visual spatial deficit task. And so basically, if the patient has left neglect, he'll be missing comedic situations that he can, because if he's not paying attention, he can't, like see. It's not that he can't see it; he's just not paying attention to his left side. And likewise with visual spatial deficits, sometimes they have trouble with rotating images, mental rotation. So what you would do is this one, you would lay out 5 picture cards. The third one would be in midline, and then 2 on each side, and then you'd have to kind of remind him that there's like 5 cards, or it's scan like a lighthouse kind of thing, And then basically what you would do is you would lay out 5 picture cards, and then you had to ask the patient to describe each picture card, like what's on the picture card. And then you could rotate some of the cards with animal pictures, to ask the patient, to find an animal that you're saying to make it more difficult. It looks like this. So this is a monkey, this is a horse, these are cats, and that's it's like a squirrel lying upside down, kind of like it's dead. And that's I forgot what that is, but oh no, that's I think that's a goat. Yeah. So I rotated. If you could see, it's kind of hard to see. The cats are rotated, so that's to help out the mental rotation. And then of course, just this is like midline, so you could sort of like tell them, like scan to the left, or like when Daniel made a presentation, maybe you just remind them that there's 5 pictures, so I want you to describe all of them, kind of thing. So this is to help with the visual spatial deficits. Okay. Level 1, second part of it, would be facial expressions and emotions tasks. So basically, if the patient has trouble understanding different emotional states, and it's not really safe for him to make jokes if he can't recognize different emotional states. So we're going to work on that skill. So same thing, you lay out 5 picture cards, and then you have the patient describe each emotion and facial expression. And same thing, you try to tell them to scan, and try to remind them there's 5 cards. And then to make it more difficult, you would ask him, to find you the specific expression that you're looking for. And then with the cards, it looks like this. So this is somebody's smiling face. Okay, hold on. I separated them. So like this would be somebody's smiling face, right? This would be somebody like sleeping, like kind of like restful, right? Somebody mad, right? Somebody like disgusted, kind of thing. And then somebody is like sick, right? So different mental states or emotions or facial expressions. All right. So those are level 1s. Level 2 would be problem identification tasks. And well, basically, it's oftentimes we find things that are silly, gross, or dangerous to be funny, and you need to help our patient, find these golden opportunities, golden nuggets of comedic potential. So what it is basically you would lay out a picture in front of them, and then ask the patient what the potential problem is, and have the patient try to explain why that would be like a problem. So. Oh, man. So if Daniel was my patient, I'd be like, Daniel, what do you see?
He's using a drill on his teeth.
Oh, why do you think that's funny?
Because he's not supposed to use a drill on his teeth.
Okay, so you try to get him the thought process behind it. And there's a bunch of them, like somebody having like hedge clippers running behind their mom. Somebody trying to fly a big paper airplane. So, cops, like high-speed chase on like little toy fights or something. So yeah, as you can see, this one's like, there's a sign that says the place to eat and then toilet, and they're both pointing the same way. So you get the point, like what the problem could be. All right. So that was just the drill example. All right, level 3, making inferences and predictions. So to be ahead of the comedy game, you have to be able to make quick inferences so that you could read the situation. So how you would do that would you place another picture in front of them, and you ask them to explain what you think will happen next. and then like then you could ask the patient to describe what could happen to make the situation funny. And let's see, like Daniel, you've probably seen this before.
What makes that funny?
No, what do you think is going to happen?
He's gonna operate.
He's going to operate, or
Or give a prostate.
oh, okay, there you go. As you can see, like, here's a dentist, right? And I don't know, nobody wants to go to the dentist, so that's kind of funny sometimes. More dentist stuff.
Or dentist.
You're at the at the jail, right? You're getting arrested. Hospitals are boring. Drive slow. So you kind of have to make a like an inference, right? Of why that would be funny, or why somebody could find that funny. All right. One more stage, I promise. All right. So that was the thing. So level 3 again. Alternate interpretation when giving new information. So comedy is at its best when it is flexible and it's able to adapt to different changes in the real world, like the situation changes. So you place another picture in front of them, and you ask the patient to explain what is happening in the picture in a funny way. So they're kind of advanced already, because they could, like explain it. And then you give the patient new information that might change the meaning of the picture, and then you ask the client to take that new information and make the situation or comment funny again. So for this one, inappropriate cards. All right, alternate interpretation. Daniel, what do you see?
They're having.
Is that all?
And he's checking out the waitress.
He's checking out the waitress.
He shouldn't be doing it in front of his girlfriend.
Who shouldn't be doing this? Okay. The new information about it, that I would probably give would be, actually his mother-in-law is actually sitting right behind the waitress. Can you make that funny again?
His mother's checking out the waitress.
Good. Or he's checking out his mother-in-law, right? Because he's.
Mine was funnier, but he's a therapist.
He's like, I'm getting paid either way. So okay. So as you can see, there's a couple situations in there, and that they always don't go funny. Yeah, it doesn't always have to be funny. Like somebody crying, somebody like look like the girlfriend's mad. Somebody has a mouse trap on their tongue. So somebody wrestling a shark. So as you can see, like it's hard. It gets harder for you to actually come up with information that like maybe the shark is like, oh, he's just helping clean the beach or something, kind of thing. Or he's a humanitarian. He's helping out the animals. All right. So next picture. All right, my patient's long-term goal would be to be funny again, and then the short-term goals would be patient will be able to identify different facial expressions, emotions, recognize the picture even if it is rotated. Patient will be able to identify potential problems given different situations, and patient will be able to make inferences, predictions about different situations, and will be able to save the comedic potential of the situation, even when giving you information that could kill the company. All right, Jen. And I say thanks for attending. I mean, like mentally attending. Thanks, guys.